Okay, so I am back to talk about more hemolytic issues. Pernicious anemia, which is also known as vitamin B12 deficiency. So the basic problem for pernicious anemia is that there is a lack of absorption of vitamin B12. Now, the reason for the lack of absorption of vitamin B12 is because of a lack of intrinsic factor. Now, intrinsic factor is a protein. Hi, Bella. Intrinsic factor is a protein. It is secreted by the gastric mucosa. This is Bella, for anybody who hasn't met her. So the intrinsic factor protein is secreted by the gastric mucosa, and it is needed for the absorption of vitamin B12. No, off, go up there. Okay. So, just in case any of you are curious, because I did a little bit of research, Jake, go lay down. What happens in pernicious anemia is that your body actually forms autoantibodies against the intrinsic factor, and that's why there's a lack of it, can't absorb the B12, and then you have a B12 deficiency. So, vitamin B12 deficiency or pernicious anemia is characterized by very large but immature nucleated erythrocytes. What this means is they have shorter lifespans. So, that's why abnormally low hemoglobin values develop, is because of that shorter lifespan of the erythrocytes. Alrighty, so now for iron deficiency anemia, that's where we saw that diet could be a cause. However, for pernicious anemia or vitamin B12 deficiency, dietary intake is usually rarely a cause. You're more likely to see it accompanying chronic gastritis, or it also may be an outcome of a gastric surgery. So, quick note on vitamin B12 and nerve cells. Vitamin B12 is actually needed for the function and maintenance of your nerve cells. And if you have a significant deficit of this vitamin, it will cause symptoms in your peripheral nerves. And these can actually be irreversible. So, pretty big deal. All right, so manifestations in addition to those typical for anemias. So for pernicious anemia, you're going to see a lot of issues with your tongue. It's going to be swollen, red, sore, and shiny. And then you're going to have a lot of digestional discomfort. It's often accompanied by nausea and diarrhea. You will have feelings of pins and needles or tingling in your limbs, so your paresthesias. And then you have some diagnostic tests. Again, I'm going to go through these rather fast. Microscopic examination of the erythrocytes, bone marrow examination for hyperactive or increased megaloblasts, vitamin B12 serum levels below normal, presence of hypochlorhydria or achlorhydria, which is dealing with your acids in your stomach, and presence of gastric atrophy. And then the treatment for vitamin B12 is going to be vitamin B12 deficiency or pernicious anemia is going to be vitamin B12 replacement therapy. So what if I took vitamin B12 orally? What do you think would happen? If you said that it wouldn't be absorbed, you are correct. So instead of taking it orally, we will actually inject vitamin B12 into the person to ensure that it actually gets where it's supposed to go. Because otherwise, if you take it orally, it's not going to get absorbed, because that's the primary issue with pernicious anemia. You got that lack of intrinsic factor, so body's not doing what it's supposed to do. All right, moving on to hemolytic anemia. So hemolytic anemia results from the excessive destruction of your RBCs, which actually makes sense. Hemo, blood, lytic, lysis, cutting, I believe, so destroying your red blood cells. You do have quite a few causes for this. You can have a genetic defect. You can have immune reaction, changes in your blood chemistry, infections such as malaria, toxins in the blood, and antigen or antibody reactions. This would be incompatible blood transfusion, also erythroblastosis fetalis. And no, I haven't looked it up, but I'm assuming it has something to possibly do with either death or the fetus. Or death of your erythrocytes. Either way, I'm only going off of what's in the PowerPoint. So, all right, moving on. We have sickle cell anemia. This is a pretty big one. There's lots about it. This is actually a genetic condition, so you do inherit it from your parents. It is more commonly seen in individuals of African ancestry. Luckily, you do have diagnostic testing available, I believe, even before you would want to become pregnant. You can get tested beforehand, which is very, very good. Anemia will occur in the homozygous recessive, and it is heterozygous for the trait. And no, I actually have no idea what that means, so if somebody wants to let me know what that means, I would love an explanation. Alright, so sickle cell anemia, you have abnormal hemoglobin, or HbS, and sickle cell crisis will occur whenever oxygen levels are lowered. Altered hemoglobin is unstable and changes shape in hypoxemia or low oxygen levels. Sickle-shaped cells are too large to pass through the microcirculation, and due to that, it'll lead to an obstruction, which will lead to multiple infarctions and areas of necrosis. All right. So those multiple infarctions will affect the brain, the bones, the organs, basically the entire body. In addition to basic anemia signs, you will have something called hyperbilirubinemia, which actually causes jaundice. Jaundice is just the yellowing. Hyperbilirubinemia, I believe, is the excessive amount of bile. It's a lot of bilirubin in the blood, I think. And then gallstones. Clinical signs will not usually appear until the child is about 12 months old. Good reason to get checked before. All right, signs and symptoms. Sickle cell anemia, you have severe pain due to the ischemia and the necrosis of tissues and the multiple infarctions that are going on. You will be pale, you'll be weak, you'll have a fast heart rate, difficulty breathing. We said the hyperbilirubinemia or jaundice, splenomegaly, which I think is enlarged spleen, vascular occlusions and infarctions. In the lungs, it'll manifest as acute chest syndrome. In smaller blood vessels, hand and foot syndrome. There will be a delay of growth and development, and possibly even CHF, or congestive heart failure. There are some diagnostic tests. You have a blood test called hemoglobin electrophoresis, and you can also do prenatal DNA analysis for a diagnostic test for sickle cell. Treatment. If you're looking at your notes, you see hydroxyurea. Well, I had to look that up because originally I thought it was like water and oxygen in your urine, which makes no sense to me. Hydroxyurea is actually chemotherapy. And chemotherapy or hydroxyurea has reduced the frequency of sickle cell crisis. You can also give dietary supplementation with folic acid for sickle cell, bone marrow transplant, immunize your kids. I won't even go further into that, but immunize your kids. Specifically against pneumonia, influenza, and meningitis. All right, there we are. All right, so indications of blood clotting disorders. I'm going to go through these fairly fast. I think they're mostly common sense, but, take a look at them if you're finding it difficult. All right, so persistent bleeding from the gums, repeated epistaxis, which is nosebleeds, petechiae, which are pinpoint flat red spots on the skin and mucous membranes, frequent purpura and ecchymosis. Ecchymosis is kind of like, I always thought of it as a hickey, like the bruising. More than normal bleeding and trauma, bleeding into a joint, which is known as hemathrossis. So the joint's going to be swollen, red, and painful. You have hemoptysis, which is coughing up blood. Hematemesis, which is vomiting blood. This is where you see your coarse brown particles, also known as coffee ground emesis, or they could be red particles. Blood and feces, you'll see this as either black, which is known as tarry stools, or occult, which is hidden. Anemia, no duh, for blood clotting disorders. Feeling faint and anxious, a low blood pressure, and a rapid pulse. These are all indications of a blood clotting disorder. Moving on. Disseminated intravascular coagulation, or DIC. And the easiest way I found to remember this is that DIC is terrible, because there's a lot of stuff about it. So, alright, this is where you have excessive bleeding and clotting, and that clotting is occurring inside your circulation. So you're going to have thrombi and infarcts all over the place. The clotting factors are reduced to a dangerous level. You have widespread uncontrollable hemorrhage. You have very poor prognosis and a high fatality rate. So you're basically screwed with this guy. So this can be a complication of many primary problems. So this is not necessarily a primary problem. This is a secondary complication. So obstetrical complications such as abruptio placentae, infections, carcinomas, or major trauma. It's some clinical manifestations. So most symptoms result of bleeding or thrombosis, hemorrhaging or oozing from venipuncture sites, arterial lines, surgical wounds, ecchymotic lesions, purpura and petechiae, hematomas, other bleeding sites such as your eyes, nose, and gums. Most individuals have bleeding at 3 or more unrelated sites. It's really bad. Any combination. Shock, microvascular thrombus associated with dysfunction in organ systems such as your cardiovascular system, pulmonary system, central nervous system, renal or hepatic systems. And then evaluation and treatment. So you're going to have a combination of lab tests, which is platelet counts, standard coagulation tests, so you'll see prolonged clotting times, detection of fibrin degradation products or D-dimer, levels of coagulation inhibitors, which will be, so the coagulation inhibitors seen with DIC is antithrombin 3 and protein C. And how are we going to treat it? Well, we're going to eliminate underlying pathological condition, control the ongoing thrombosis, maintain organ function, medication, replace the coagulation factors or platelets, and replace the fluid loss. All right, let me take another break here.